Thank you very much. I'm delighted to be here. I'd like to first of all thank Amber Hill and the rest of the group invited me to come here. And first slide. I'm Alex Seifalian, as you heard, work in the field of nanotechnology and regenerative medicine. I base at Center for Nanotechnology and Regenerative Medicine, which is within the Department of Surgery, based at Royal Free Campus, which is Royal Free Hospital. And I develop a number of organs, and mainly we develop organs go to human, and we have a new technique of developing to faster route to move it to translational. So the organ we develop, we make nanoparticle. Nano is extremely small. So we're looking at the size of your head is about 300 micrometer, the diameter. So we're looking at the 300,000 nanometer. So extremely small. So the nanomaterial like carbon nanotube or graphene, recently in Manchester, people got the Nobel Prize, is about 2 to 8 nanometer. A blood cell, red blood cell, is about 30,000 nanometers. So, this is very quite good. So, carbon nanotube and graphene is used a lot in military now. In military, the jacket is made from carbon nanotube. It's lightweight and 50 times stronger than steel. But in medicine, we use carbon nanotube for drugs delivery because they have a large surface area, and you could attach drug to it and go to the, say, cancer cell. And because it's sharp, it goes into the nucleus of the cell and destroys the cancer. And also it's conductive. It can be used as a nerve regeneration or cardiac patch, and also cancer treatment. Here, this patient, and sorry, just a typical example here we're giving it. If a patient got breast cancer, as long as you could get the carbon nanotube inside the cancer cell, either just injected in the tumor or attach it to antibody, goes to the tumor, and then shine light to it, just this light to it, in 40 seconds, from 37 degree become to 50 degree. And at 49 degree, cancer cell die. Usually surgeon, when they remove the cancer, could be in the brain or in the breast, wherever, they remove the cancer, there's a normal cell. It's very difficult to say where is the margin. And a small cancer cell is not visible. That's why they do chemotherapy. If you could get the carbon nanotube to cancer, even just individual cell, you just shine light to it like this and kill all the cancer cells. And so that's the application. And lots of people, including us, working towards it. Other nanoparticle is a fluorescence nanoparticle. It looks like a dye, but it's a very special dye. It doesn't mix with things and stand alone. So we're working on injecting it and tracing the cancer or tracing stem cell. There is, for example, there's silver gold nanoparticle. We're looking at about 1 or 2 or 10 nanometer, extremely small. We use silver and gold nanoparticle as an antibacterial, anti-infection. And we mix it with our organ development so organ doesn't get infected. And we use magnetic nanoparticle to track the stem cell or move the stem cell from one part of the body to another part of the body. But our main expertise to make material which could be inserted in human. There are not many material in the market, or as a research, you could put it in human. You could make something to put in the video. You got the teeth filler, and that kind of stuff. But not inside the body, there are not many. So we developed this material based on nanotopography, nanotechnology, and we've done a lot of toxicology study. We could put in the human. The material, most labs, you tend to work on sort of chemical stuff, and we work a lot on insect. See how they behave. Like a beetle, like other insect they behave. Here, we get a lot of butterfly wing from Professor Parker from National History Museum, South Kensington. And because when you look at the wing, they got different topography. And we sterilize that, and we grow cells on it. And wherever the cell grows better, we fabricate that onto our scaffold, to our organ. Also, we look at the chemical, what chemical is made of, and trying to synthesize that chemical into our material. So that the pulse nanoparticle you saw previously on the material we make, based on butterfly wing. This is without nanotopography. This material with topography. This is shown by atomic force microscope, and those are about 8 to 10 nanometer. So, and the cell grows much better on the topography, nanotopography, and lots of other activity. And we've got large surface area, so cell can lay down much better. Our material is the strongest material in the market for medical application. The advantage of that, you could make extremely thin film, like for contact lens or heart valve. We've done the 3-year toxicology study, preclinical study on our material. This is, yes, it's perfect. You can put in a human. We make 2 families of material. One family, which is this one, it does not biodegrade, stay there forever. And we use that mainly for adult organ. Other family we make, which is disappear gradually, and we use it for children. Like then the salt goes inside the water, the salt dissolves, it comes out, or sugar, and make like little hole for stem cell to grow inside it. We use butterfly wing as previously. That's the pattern. So we put our material that fabricated, and this flat without this pattern, cell grows less. And here with pattern, you could see grow much more. We can put peptides or antibody onto the material and capture the stem cell from circulating blood. Here, we manufacture a tube, which for coronary artery or leg bypass. Same mechanical property. We do preclinical study. So when we put it in preclinical study, inside it become completely epithelial, endothelialized. That's what you have inside the artery. And now we're going to clinical trial for heart bypass and for the leg. We make heart valve, which go through the catheter, especially either for children got defect, heart defect, and or for older people that cannot go through general anesthesia. So I had a PhD student. She came, Carla Chalupka. She was from Switzerland. She wanted to develop tear duct. I didn't know there was even a problem. So tear duct is a duct if people have cancer or trauma, it removed. Hence the tear just running on their face. So currently people put glass tube. This is about 4 centimeters and 1.5 millimeter diameter. Imagine tear duct in a glass tube goes here to the nose, drain the tear. It breaks, it comes out. We developed this one, she developed this one in our lab, which has got silver nanoparticle. And she put on the 6th patient, and it still is open and patent. Our main expertise, somebody came to us, one of the surgeons from Iceland, and said, could you make a trachea? This patient had a disease, cancer, trachea, and they took him all over the world. Nobody wanted to do anything to do with him, and they say he's going to die in 1 week. So they gave us virtually 10 days to make a trachea. We made a trachea for him and bronchi. And at the time, we couldn't, inside trachea is a certain stem cell, a cell type called epithelial cell, which should clear the mucus and also anti-infection. We didn't have time. So the surgeon, Paolo Macrini, he took some nasal tissue and his epithelial cell, and he just cut them bits and pieces and sutured it inside it. And then he transplanted. And after that, we looked through the camera after 8 weeks, become completely epithelialized. It's a bit like putting grass, and completely become everywhere grass, And so on the brain, we started working on Alzheimer's disease for drug delivery, stem cell delivery. We have a small stent made for intracranial, a stent, which is currently going to preclinical study, and we hope we go to clinical study next year. And also we have a filler, still is early stage. We could fill in the brain if there's an aneurysm. We could fill it with this material and then block it. And so with our technology, we hope which we could repair and replace organs which is damaged, and require replacement. Finally, I want to thank all my group,
which is large. And on top of that, there's another 20 PhD students, which, you know, I haven't done that. You know, so, the work I've done, and I've directed the center. Thank you very much.